Hello, I'm Dr. Mike. Demodectic mange, also referred to simply as Demodex, is a common mite found in dogs. Usually this mite is not a problem. However, in puppies or adult dogs with compromised immune system, these mites can cause a variety of skin problems. To learn more about Demodex, we are going to meet with Dr. Jeff Glass, a veterinarian in Irvine, California.
Demodex is a parasitic disease caused by a mite called Demodex or Demodex canis. It's an inflammatory disease where this mite is found in the hair follicles, and when something suppresses the body's immune system, these mites will then start to multiply, and when they multiply, it will cause their hair to fall out. I think the most important thing for clients to know is that Demodex is a disease that's not contagious directly from one dog to another. A lot of times people are worried when the dog has Demodex, is it going to be transmitted? The way that they get it is from their mother. It's usually transmitted in the first few days of life. When the pups start to suckle on the mom, they'll often get that mite. That's why it's often found around the face and it's often found in the front feet. It can be found anywhere in the body. So what happens is that many dogs will have this mite living in their hair follicles, and usually what will happen is it'll just sit there in their hair follicles and not cause any real problems at all. If something suppresses their immune system, which can be as simple as them having worms and parasites, which many puppies will have, this can then cause this mite to now start to multiply and grow, and when it does multiply, that's when it causes the symptoms and causes the problems. Usually a healthy dog, that even if they've been exposed to that mite and have that mite in the hair follicle, will not show any signs at all. The symptoms of Demodex can be very variable. Sometimes it can just be a very small patch of hair loss, which sometimes people can just confuse from a scratch, and it can be just a small area of hair loss in any part of the body. And usually those are the much milder forms. It can become much more serious where we see dogs that can have hair loss in multiple patches all over its body or even the entire body. When they get secondary infection from this mite, because their immune system is down, they can get secondary bacterial infections, which can then result in scabs all over the body, crusting, and at that stage a lot of the times the dogs will be itchy and scratching. When there isn't infection, typically Demodex is a disease that is not an itchy type of disease, so usually a dog won't be scratching if there isn't secondary infection. When you see Demodex in a younger dog, it is much less of a concern and often associated with a localized. In older dogs that get Demodex, those are the ones that you're much more concerned, because that suggests something that's really suppressing the immune system, which can even be as serious as cancer. Because there are many causes of hair loss in a dog, you want to make sure that your dog truly does have Demodex. Diagnosing Demodex is a relatively simple procedure where your veterinarian may want to do a skin scraping, where he'll scrape a part of the skin, look it under the microscope, and then he will see the mite in various stages. If he sees that, it confirms the diagnosis. So it's not a difficult disease to diagnose. As far as treatment is concerned for Demodex, for localized, when you have a very small area, if it's a young dog with a small area, sometimes treatment is not necessary. There are topical ointments that you can put on a dog which may or may not help to make it resolve quicker. With generalized Demodex, or if you have Demodex in an older dog, then probably in most cases treatment would be a good idea to resolve the problem quicker and prevent it from getting worse. There are various different types of treatment for Demodex, and you definitely want to consult with your veterinarian to find out which option he feels would be best for your dog. There are different types of dips that you can use, for example, mite dip. There are oral treatments like ivermectin or milbemycin. Topical ointments can be used, and then sometimes if there's secondary infection, antibiotics would be warranted. Prognosis for this disease in young dogs is usually very good. Most young dogs will, with various types of treatment, will respond very well and do extremely well. In older dogs is when you become a little bit more concerned, because in those cases there's usually an underlying cause, and when there's an underlying cause, often you need to find what that cause is before you can actually treat the Demodex.
Demodex is not contagious to people and is generally not considered a problem in healthy adult dogs. However, in some pets, it can cause severe skin infection. If your puppy or older dog has hair loss, you should bring it to the attention of your veterinarian. He or she will decide if treatment is necessary and what options are available for your pet. I hope this information is helpful, and thanks for watching.